Welcome to the Joint Replacement Center class. Thank you for choosing our Joint Replacement Center for your new joint. My name is Linda. I am the nurse navigator for the Joint Replacement Center. And what that means to you is that I'm your go-to person. As navigation applies, I am going to help you preoperatively, operatively, and postoperatively, which means before, during, and after your surgery. So any concerns, any questions, anything that I can help you with, that's my job, and I'm pleased to do that for you. In saying that, you will have my card in your bag that you should receive today, and that is my office number, so you can call me. If I'm not directly there, just leave a message and I'll get back to you as soon as possible. Let's talk about the rest of your care team. You have your surgeon, and you have probably already seen him. If not, you will be seeing him before surgery. And we have two very fine surgeons, Dr. Thomas Iser, and Dr. Danny Giles. They have a wonderful crew, and they have wonderful people at their offices, and it's all our jobs to help you get the best outcome that you can with your joint. There's also nurses in every department that you'll go through, pre-op, post-op, and in JRC. You'll have lab people drawing your labs. You'll have dietary people helping you order hopefully nutritious food. You'll have housekeeping coming and cleaning your room. Aides, you will have an anesthetist, excuse me, that will come and talk with you before surgery and help you choose your best preoperative medications and your surgical medications. So there's a lot of people that it takes to get this done, but our job is to make it the best for you that it can be. Let's start with preoperatively. You're already in that process, that stage. You've seen your physician, you've seen your surgeon, you're here at the class, you've had your lab drawings, your tests done like an EKG, possibly a chest x-ray. So what we're going to do now is we're going to talk about what to do from here on out in the preoperative stage, what to do to get ready for surgery. So number one, you need to stay healthy. So stay away from ill people that have colds or that are sick. Try to keep from having any type of infection, abrasions, cuts, multiple bug bites, anything that breaks the skin barrier could possibly cause an infection and get into that new joint. So we got to make sure none of that happens. If it does, contact me and we'll see what we need to do about it. The sooner the better. Good hand washing, excellent hand washing. Wash your hands often and wash them very thoroughly. That decreases a lot of infection going on. When you're out in public, use your hand gel, your sanitizers. Get your home ready. So you need to make sure that the home is going to be very safe, because not only is your leg not going to work well for a while, you're going to be using a walker. So you need to get your walker if you have one. If you don't have one, just walk around and look. Is this wide enough for a walker? Do I need to move furniture? Are there cords somewhere hanging down that you need to secure so that the walker or you do not get tripped on them? We do not want to fall. Falling is one of the worst things that could happen, because we could actually break the bones around the new joint probably. So we don't want to get an infection and we don't want to fall. So make your room and your home very safe. You want it to be clean to not have infections, specifically your linens, your bedding, your towels, anything that's going to come close to your skin. Think about what you're going to do for your pets. Who's going to take care of them? Are they going to need to be kenneled, or we don't want them jumping on you, tripping you, that kind of stuff? But who's going to feed them and water them and let them in and out and that kind of stuff? You're also going to need to think about who's going to help you, because you are going to need somebody for a few days anyway after the surgery to stay at home with you. And then after those few days, you're going to need someone to check on you several times. You will need somebody to get you to your therapy session if you're having that out, and your doctor appointments, and pick up your medications for you because you will be unable to drive. Think about where you're going to do your therapy. Our first and foremost option is going to outpatient therapy. That gets you out of the house, but you have to have someone take you. If you have something that keeps you from getting out, such as multiple stairs, or you just do not have anybody to get you there, we will go to our second plan, which is having home care therapy come to your home for just a little while, or even up to the whole time, depending on what you need. We'll go by what you need. Let me know what you choose so that we can make those things happen as soon as possible, so everything will be ready for you. If you don't have a walker, don't worry about it. We'll get you one ordered when you come for your surgery. Another thing to think about is maybe preparing your meals ahead of time, having them in the freezer, or buying things that can just be popped in the microwave to make it easy for you and whoever's there to help you. You will need a chair at home. It should be a high chair, not a low chair, so you don't have to squat down low. It needs to be sturdy, like a recliner. A recliner's perfect. Don't worry if you don't have a recliner, just a chair with arms that you can push up from. So you need to have that ready as well. 1 week before your surgery, you need to get you some antibacterial soap. That you can buy that anywhere. Walmart's got it, dollar store, but just make sure it says antibacterial. Now you don't want to use this all the time, just a week before to shower with. No bathing, just showers. Do that daily for 1 week before your surgery. The day before your surgery, I will call you. And my questions to you are going to be, do you have any skin abrasions, cuts, scrapes, bug bites, anything that could cause an infection? I'm going to ask you if you have a walker, and then I'm going to remind you to take extra strength Tylenol to the morning before surgery and to the night before surgery. The studies have shown that that just helps somewhat with the postoperative pain the next day. I'm also going to remind you to take Gatorade. You will be provided a bottle of Gatorade in your bag this morning, and you will drink that 2 hours before your arrival time. I'm also going to remind you to take your special showers. Your special showers are on the night before surgery and the morning of surgery. So let's talk about your special showers. What you do is you shower with your antibacterial soap. And then you would have been provided in your bag also Hibiclens. It may come in a white bottle or this blue bottle. You will take this the night before surgery after you wash with the antibacterial soap and rinse it off good. Now you can just use what you normally use on your hair and stay away from your genitals with this stuff, because this stuff is strong and it's harsh on the skin. You will take a clean rag or sponge, whatever it is you wash with, and you will put like about half of this bottle on that. And you'll wash from here down, staying away from the genitals, paying close attention to your hip or your knee, wherever it's going to have your surgery. Turn the water off, then apply this. And because this has to sit on for a minimum of 3 minutes. Once it has set on for a good long while, then you rinse it off. Don't follow with anything else. We don't want you washing what's left of this off. The night before your surgery, you can use whatever you like to normally use. Lotion, deodorants, all of that kind of stuff. The next morning when you get up, I want you to repeat that whole process. But this time, no deodorants, no powders, no perfumes, no lotions, no makeups, nothing on your skin for surgery. Okay? So also, the day before surgery, they will call you from the surgery area, the pre-op area, and they'll let you know your arrival time. And just as a reminder, remember that your arrival time, 2 hours before, drink your Gatorade. So what do you need for your stay here at the Joint Replacement Center? The first day, you should just wear comfortable, loose clothes. In fact, you could wear what you're going to wear the next day because you won't have them on long. When you get here, they'll have you change into a gown. So you're going to wear that gown after surgery also and through the night. But you will probably want to have something to pull up, like a pair of shorts or something under that gown, because you will be getting up. You may even walk in the hall. Next day, wear your comfortable clothes. And it needs to be something that you can go to the gym in, that you can walk in the hall in, sit up, be dressed in, and also take into consideration that we're going to need to look at your incision, whether it be your hip or knee, and so the pants need to be where we can get to that or stretch over it. Also, you'll have your dressing changes, so we'll need to get to the incision for that. Then bring whatever you need, as far as some women like to bring makeup, toothbrush, deodorant, whatever it is that you need. Also feel free to bring, if there's something that makes you comfortable, like your own blanket or your own pillow, but you do want to make sure that you put it in like a colorful pillowcase, because ours are in white and we don't want you to lose your favorite pillow. You want to leave your valuables at home, like jewelry, that sort of thing, because the hospital will not be responsible for them. But I understand that people want their cell phones or their iPads, so bring whatever you feel like you need. Also, if you wear dentures, eyeglasses, hearing aids, bring those, but bring something to put them in. We don't want them to get lost in the laundry or taken off on the food tray or something like that. So let's protect those. Shoes are important for your rehab. You want comfortable shoes. Tennis shoes are great. You may have a little swelling in that affected extremity, so you might want to think about something that you can loosen up, like the shoestrings or the Velcro. You don't want to have any open-toed or open-heeled shoes. Those can be a tripping hazard, and we want you also to have good soles so they don't slip on the floors. We want to keep you safe. Let's move on to the day of surgery. So you're told what time you have to be here, so you know 2 hours before to drink your Gatorade, and then just arrive to the ambulatory outpatient surgery area, and that is on the southwest corner of the hospital. And you just come to the desk, tell them you're here to have surgery, and they'll get you back to the preoperative area and into a room in there very quickly. You can take one person into the room back there to wait with you, whoever you prefer, and they can stay with you until you actually go to surgery. When you do get here and they get you back in that room, they're going to have you put on a gown. They may have you put on a pull-up. That is because knees in particular tend to have spinal anesthesia. Spinal anesthesia can make you incontinent, which means that you can't control your bladder for a little while after surgery. And so we want you to have that pull-up on so you don't have an accident, to keep you protected. They will have you put on little socks, throwaway socks on your feet, and a covering on your hair. They will also start an IV. They will give you a dose of antibiotics, and they will have you swab your nose, again, to prevent any infection from happening. So what they do on the nose swab is there's 4 nose swabs, 2 for each nares, the left and the right. And this is to prevent bacteria that could be growing in your nose from causing an infection later on. So you will take the first swab and do the right side really, really good, going in one direction. Then you will take another one on the left side. Do it really good, get up in there as far as you can, do it really good, go in one direction. See, I can't pat my head and rub my tummy at the same time. So then you take the second swab for the right side and go the opposite direction of where you were going and do it really good. Same thing on the left side, okay? So you'll want to empty your bladder. Your surgeon will come in and talk to you, and he will mark the surgical site, and anesthetist will come in and talk to you, and you will decide with him what's best for you. Typically, the knees, they give the twilight drugs, the Versed and the Propofol. And that, some people don't even remember things after that. Some people do just a little bit, but they're good drugs and they help. And then they give the spinal, which numbs you from here down. And then they give a canal block in the affected leg. And it tends to make the joint numb for, well, up to 72 hours. The hips sometimes get a spinal and sometimes they get a general to do the hip. So, but you will decide with your anesthetist what is the best for you. Also, if you've ever had trouble with surgery, such as you got nauseated afterwards, or you always get nauseated afterwards, this is the perfect time to talk about that with your anesthetist so that they can give you drugs in your IV before surgery to help with that postoperatively. So the nurse will ask you questions like we always do, have you sign some more papers, and when it's time, they'll take you to the surgery area. Sometimes you have to go to the holding area before you go to the surgery area. Your family will be able to wait out in the waiting room, and your surgery typically lasts at this point 2 hours, maybe longer, maybe shorter, depending on how much work they have to do. And then the surgeon will come out and talk to the family in a special room, and when they have closed your incision, you will go to recovery. In recovery, you'll be there 30 minutes to an hour approximately, and then you will come up to the Joint Replacement Center. Let's talk about your specific surgery for just a minute. I have some models here. This is a model of what a normal knee looks like. And as you can see, there's the top bone on your leg, the femur, and the bottom bones. Trying to keep this. There we go. Okay, so you've got these ligaments running here. When they do this surgery, they're going to move these ligaments to get to the joint. And also, you have the anterior cruciate ligament. Can you see that? Right in there. You will, if you still have an anterior cruciate ligament, a lot of times we destroy it, then this will go away because of where it's positioned at. The patella, which is your kneecap right here, it may be deteriorated too, and in which case it may have bone spurs. They may have to shave that down some. They may have to add to it to make it work correctly. So when they do your surgery, you also have this layer called the meniscus, and most of us have wore that out and we're bone on bone. But you can see they have to do a lot of work and a lot of movement of muscle and ligaments, which is going to make your knee very, very unstable. So it's very important that you do not get up by yourself, that you always call for the nurse or the therapist to come help you get up. And when you do get up, you will have a walker and a gait belt the whole time you're here. Now, this is what your knee looks like after surgery. This is what they put in there. You're positioned very carefully on a special table, and your knee is in a bent position in a holding thing on the table, and the surgeon takes this top bone with a guide, and he makes 5 different cuts plus these holes, and then this is tapped in. Sometimes cemented, but usually it's just tapped in. They replace the meniscus with this polymer right here. On the bottom bone, they shave it off, they put a V in, and then this is cemented in, cleaned up, and there's a lot more to it than what I'm really showing you, and the surgeon is much better at it than I am. So this is your new knee. And they work that, and they x-ray it, and they make sure that everything's like it's supposed to be before you ever leave surgery. But It can be unstable and it can slip on you and it can give on you. So we can't get up by ourselves. Now on the hips, this is what a normal hip looks like. This would be a right hip. See all these ligaments, and there are also muscles in here. Those have to be cut into to get down into this hip joint. So when it's done, it looks like this. In here, this is cut out, and this porous surface, this new prosthetic part is put in here, and this glides. Sometimes they use glue, sometimes they don't. The bone, that's why this is porous. The bone will actually grow back onto this to hold that in there. For now, the bottom part, this bone, they cut in here and they put this rod in with this ceramic head, and that goes in there so it can move good. But right now we have to be careful to not pop it out. The tendons and ligaments have been moved and cut. So always again, walker, gait belt, and call for assistance. Surgery's over, you're in recovery, and you're coming to JRC. When you get up to JRC, you will be put in a room. They will put a cannula in your nose. It looks like an oxygen cannula, and it can be hooked up to oxygen if we need to. But for now, we're going to measure your carbon dioxide level because of the twilight medications that we gave you. And we're going to measure it from now until tomorrow morning, your post-op day 1. So you will have that in your nose all night. For 2 hours from the time you went to recovery, you're going to have a non-rebreather oxygen mask on. It goes over your face like this. It has a bag on the end of it. It hyper-oxygenates you. It's kind of like being put into a bariatric chamber. Getting all that oxygen into your system does for 2 hours is it jump-starts the healing process. It carries a lot of oxygen down to the molecular level where it can help with nutrition and healing. We will also apply the, we call them scuds or ALPS, alternating leg pressure to your legs. They just wrap around the bottom of your leg like this. They Velcro on. They're attached to a tubing with a little machine at the bottom of your bed. There's a bladder in here, and it will inflate and just gently squeeze your leg. They should be on both of your legs, and you need to wear those whenever you're in the chair or in the bed. What that does is it helps prevent blood clots. Our blood flows down because our heart pumps it down there, but we get our blood back up to our heart by moving and walking. So when you're not moving and walking, you need a little help. One of the things that we want to prevent is blood clots from happening, so that's why you will wear these. Also, you will still have an IV. You will get 3 IV antibiotics just to prevent any infection from happening. Those will be approximately 6 hours apart from each other, and you'll have those, should have those completed by the morning. Our goal is to get you up out of bed within 4 hours of you arriving to our unit. So when you can start moving and you can put weight on your legs, then we will get you up. You can eat or drink. We want to be careful and make sure that you're not going to be nauseated. So we ask that you take it slow. And then remember too, you're going to have that oxygen mask on. So we don't want to order food until the oxygen mask comes off. We have a way for you to order off the menu. There's a menu on your bedside table, and all you have to do is dial 3663. They will fix your food as soon as you order it. They'll bring it up to you. If you've had a knee done, you're going to come back from surgery with a bulky dressing on, and that dressing is going to have an ACE wrap from way above the knee to down, way down on your leg. That is going to stay on until tomorrow, post-op day 1, because of the swelling and possible drainage. So We want to elevate and ice that leg, but nothing directly under the knee. The hips, they usually come back from surgery with the Aquacel dressing. When you start hurting, the things that they gave you to prevent pain or prevent you from feeling while they were doing surgery are going to start wearing off. So we have pain meds for you. So you let us know. We're going to use the pain scale from 0 to 10. 0 meaning no pain whatsoever. 10 being the worst pain that you could ever imagine. It's a way for us to be able to measure to know if what we are doing is helping you and getting you where you need to be to a tolerable level. So let's talk about the Aquacel dressings. The hips typically come back with an Aquacel dressing on their hip. The incisions for the hips are smaller. They usually come up and then kind of curve backwards, but this fits right on there. These Aquacel dressings are wonderful. They are very flexible. They are impregnated with a antibacterial substance to help fight off any type of infection. They also seal very good, so you can shower in them. No bathing, no soaking, no hot tub swimming pools, anything like that. But you can take a shower with them on, and they can stay on up to 5 or 7 days. So whatever your physician says, whether it's 5 or 7 days, you will take these off at home. Now, the knees, again, have the bulky dressing. The next day, post-op day 1, we will take that dressing off. It's longer. Used typically for the knees, we have to have a longer one. And when they put this dressing on, they'll have you bend your knee at about a 30 degree so that it seals and it fits really good when you get it on. And as you can see, I've got it good and on. But when you take it off, you want to protect your skin. I hold the skin like this, and then it's kind of like pulling taffy. You just gently work a corner loose. So you get that corner loose, and again, protect the skin underneath there, because you see that's really pulling. So you get that, just get that corner loose and stretch that corner. And as you see, it works again. Stretch, you're pulling taffy. Just keep protecting your skin and pulling taffy. And you do that all the way around. Okay? And if you have therapy, most therapies are happy to help you with this. But it's really not hard. It just takes a little time because you want to protect your skin and not tear your skin when you take it off. Post-op day 1, you will have a morning session with therapy and an afternoon session with therapy. And we have goals for you to meet before you can go home, such as you can safely shower, you can safely walk 150 feet with just standby assistance using a walker, get in and out of a vehicle, you can get up and down out of a chair, reach your things, do your own dressing. There's several of them. So when you can meet those goals, you will go home, and that will probably be this afternoon. So you'll have your breakfast, you'll get pre-medicated, you'll have therapy, you'll have lunch, get pre-medicated, and you will do your therapy and probably go home. Go home with instructions on how to take care of. You'll go home with my number. Call me if you have any problems. If I haven't heard from you in 5 to 7 days, I will be calling you to see how you're doing and make sure everything's working. Some of the things that I do want to talk about are things that can happen after surgery. And, all surgeries can have complications. So we want to prevent any complications from happening. And the first thing is infection. We don't want to get an infection in that joint. That can be a long ordeal and a hard thing to have to take care of. You don't want an infection in your joint. So again, good hand washing, follow all of our instructions, do what we tell you to do to keep that incision good, and keep your fingers off of that incision. When the Aquacel dressing comes off, in 5 to 7 days. You can leave that incision open to air, but you want to make sure it's in a clean area. If you're not going to be in a clean area, cover it with a non-stick pad. So another thing that we worry about is you developing an infection in your lungs. So you will be given, when you arrive to the floor, an incentive spirometer. It is a blow bottle that you actually use to inflate your lungs and to keep things moving in there and keep bacteria out of your lungs so you don't get pneumonia. The other thing that we can worry about happening is, one thing is constipation. You will be giving pain meds constipate. You may be given iron constipates. So we want you to drink lots of fluids. We will put you on stool softeners twice a day, but they only soften the stool. And then you need to eat a lot of fiber in your diet. And if needed, we want you to take a laxative. So get you some milk of magnesia, some magnesium citrate, something like that over the counter, and have it at home so you'll be prepared in case that does happen. Another thing that we don't want to happen is what we call a DVT, a deep vein thrombosis, and that is a blood clot that usually forms in the lower legs. And how we keep that from happening is we will put you on a blood thinner. If you are on a blood thinner now, you will probably be placed back on that same blood thinner. Typically, if you're not on a blood thinner, then we will put you on low-dose aspirin, 81 milligram, twice a day for a few weeks. And that will be enough to thin your blood enough so that you don't develop a blood clot. But the best way to prevent a blood clot is to be moving so that that blood can't stagnate, can't sit around, and it gets pumped back up through the heart. So walking and moving and doing your exercises and your book exercises twice a day, every day, plus your therapy will help prevent those blood clots from happening. Now you are at home. You're either having therapy come into the home or you're going out to therapy. So it is very important that you be a participant in your therapy for you to have the best outcomes. So again, do your exercises twice a day, do your therapy as instructed, take your pain meds as instructed and as needed. And if there's any complications or you need anything, feel free to call me because I want to help you have a good outcome. Thank you for your time.